Good afternoon, everyone. Thanks very much for joining us at this webinar to talk you through the new dental e-portfolio for Dental Foundation and Core and a variety of other dental training programs being used across Health Education England, Health Education and Improvement Wales and Northern Ireland Medical and Dental Training Association from the 1st of September 2020, sorry. So just a quick outline of our agenda. I'm going to spend a very short amount of time just introducing the presenters and giving you some house rules, and then we'll get straight into the training program. We'll have some question and answer breaks throughout the session, and we'll have time at the end of the session as well to go through your questions and to generally wrap up the session. So my name is Kata Varnai. I'm the ePortfolios project manager at Health Education England, and I'm the project lead for the new dental ePortfolio. And on the session with me is Peter Cranfield, who is Regional Advisor and Training Programme Director at Health Education England in the Midlands and East. And Peter is the technical lead for the new ePortfolio project. So some house rules. The webinar is being recorded. We will circulate a link to all of you who've attended and anyone else who wasn't able to attend. We'll do that as soon as we can. There will be written training materials provided later on this month and during September 2020 as well to help you manage the sort of training of other staff and to remind you as well of how the system works, and we'll be developing more training materials throughout the new training year. So you should be able to use the question and answer box throughout the session. So do ask us any questions that come to you at any point. The questions will be moderated and published as appropriate, so don't worry too much if your question doesn't show up straight away within the moderated set of questions. I'll be making sure to go through those regularly, and I'll try to group the questions as well so that we can make good use of the question and answer time. Bear in mind that there's a slight time delay between you sending your question and us seeing the questions, so just be patient with us. And like I said, we'll try to handle most of the questions during specific question and answer breaks. And do send your questions in whenever you have them. You don't need to wait for the breaks, but of course you can send them during the breaks as well. Okay, so I will now hand over to Peter to take you through the ePortfolio system. You're on mute, Peter.
Thank you. Welcome, everybody. Thank you for logging into this session. As Kata has said, this is for your benefit. This is information for you. So if you do have questions, do please ask them. We really do wish to know. There is a time delay. There's a time delay, first of all, before you see what we're saying and showing, and then a time delay in getting the questions back. So please, if you do have a question, please make sure that you write it in as early as you can, and then hopefully we'll see that without too much delay. We have had a webinar about a month ago. Some of the material I'm going to show today will be similar to that which we saw last time, but there are new things, and we can also present things in a slightly different way because there's been developments since a month ago. So what I'm going to do now is start my presentation, and let's see what we can do. There we are. So this is the dental ePortfolio, and it's not just a Dental Foundation training ePortfolio. This webinar has been set up for educational supervisors and training program directors in Dental Foundation training. But the portfolio itself has been set up for dental core training as well, performers list validation by experience, and dental therapist foundation training. It's all built in one platform. Many of the tools are used in each of the portfolios. So some of the things I'll show you today might come from a foundation training portfolio or from a core training portfolio, because the tools are identical in many instances. Okay, dental foundation training is planned to cover the dental foundation training curriculum, which means that it has a learning schedule, a timetable. It does emulate a lot of the functions of the current e-portfolio, and we think it's got an improved user experience. We also think it's got far greater flexibility, not only in terms of use, but in terms of how it can develop the portfolio and improves the experience for the trainees and you, so that greater learning is carried out. And of course, there are links with the dental core training e-portfolio. The PLVE portfolio, it's the first one which we have for PLVE. Its content is very similar to dental foundation training, but there is no timetable. I'm going through this because I know some of the TPDs involved with dental foundation training, and also some of the ESs are also involved with PLVE. So it's a very similar portfolio, but there is no learning schedule. Again, great flexibility to cater for the needs of the individuals in PLVE. And the therapist foundation training portfolio is again built on the DFT one. There are quite a lot of pilot dental therapist schemes, and this portfolio is built on the DFT portfolio, but cut down with all the extraneous material removed. It's adapted to the therapist's scope of practice. Core training portfolio, and I'll tell you about this because some of you might be involved with 2-year general professional training, where some of the trainees undertake dental foundation training part of the week and dental core training the other part of the week, and they do this over a 2-year period. The layout is similar to the DFT portfolio, but a lot of the educational tools which have come from the current TIRAS portfolio have been used within the new e-portfolio, the Axia portfolio. But we have incorporated some extra tools from the DFT program especially, and I think we've ended up with a very, very coherent portfolio which somebody undertaking GPT would find themselves able to switch between very, very easily, and they'll find that some of the links of information is linked from one portfolio to the other. And again, the flexibility, I can't stress the flexibility too much. Now, things that we've enhanced within the portfolio, we've enhanced the reflections, the learning needs have been enhanced. These are totally new for dental core training. Patient satisfaction questionnaire, we've enhanced that, and again, that's new for dental core. Multi-source feedback, we've improved that and we've got it working properly. Professional leadership and management, that's present. Significant events log, we've made a proper reflective significant events log, and we've put in a complaints log. We've enhanced the buddy assessor's mode of action, so it's much easier to carry out buddy assessments for more items. And also we've enhanced the DOPS. The clinical experience log has been updated and improved, and the complex treatment log has been changed so that it automatically populates itself as the clinical experience log is completed. New items, we put in a personal development plan, and I'll show you that. It's based on the GDC plan. CPD log is built in. We've also got a checklist, an FRCP checklist, so that the trainee can see what is remaining, and you as educational supervisor or training program director will be able to see what remains to be done. Also, for educational supervisors and training program directors, we've got a notes section built in. Further things we've added recently because of the COVID-19 situation, we've put in a simulation report, placement report, a DCT, we've put in a remote KEX. Something new which has come in over the last 2 or 3 weeks, the clinical categories checklist and report, and I'll show you that later on. We've added extra items to the induction checklist and to the clinical experience items, and we've also added a generic DOPS, and I'll dwell on that a little bit later. The portfolio is going to start on the 1st of September 2020. That's just over a week's time, and we're well on schedule to getting there. All the names of educational supervisors and trainees are set up and loaded by the regional administrators. So it's carried out locally. This year, because we're setting up from scratch, we're going to be fairly close to the end of August before we have everything running properly. But next year, the system will carry on. We won't have to re-enter all the educational supervisors and TPDs again, and administrators will be able to start entering trainees as soon as we know who the trainees are in a particular area. You're going to get your login details sent to you very soon. Some training program directors might even have received their login details today, because even as we speak, AXE are uploading details of administrators and details of training program directors and deans, and they'll be getting sent an email which has their login details. For educational supervisors, your username will be your GDC number. You'll be sent a password and also the web address to log into, and then you'll be able to log in. Now, an email has been sent out with an information sheet explaining to you that when you first log in, you won't see very much at all because there's no portfolio until your trainee has started. Development is still in progress. We still have some further things to add, and I expect we'll change some things as we find by experience that some things perhaps don't work quite as well as they could do, or perhaps we can make them work even better. So, without any more ado, what I'm going to do is I'm going to give you a short overview of the DFT e-portfolio, and then when I've done that, we'll have a brief pause to see if there are any questions at that point, and then I'll start having some explanations of some of the new areas and some of the new processes. So,
hi Peter, our first question is, how well are joint trainers catered for?
Okay, joint trainers are catered for fairly well in that you'll have your own logins, you'll be able to see your own things. One thing which we have not done is, in the old e-portfolio, every time you wrote something, names and times were written onto every single box. Now that has disappeared. It does mean that if you are a joint trainer and you're a joint educational supervisor and you've added something, it would probably be very wise to add your initials to the bottom of that so that we know who has provided that. We're looking into the ability to make some sort of identification automatically attached to things, but again, it's trying to prevent having the situation we had with the last portfolio where everything was renamed every time. Are there any more questions at this stage, Kata?
No, that's it for now. Thanks, Peter.
Okay, as I say, joint trainers can easily be catered for. You can have up to 4 trainers with 1 trainee. We have as many training program directors as we like with a scheme. There is huge flexibility. The difference about this e-portfolio is that the portfolio stays with the trainee, and the administrators have the ability to change ESs and TPDs and schemes just at the click of a mouse So if you as an educational supervisor need to take a period of parental leave and somebody else is going to take your place, it can be altered very, very easily. If a trainee decides that they have to move, or they are moved, or something happens perhaps to another scheme or another area or another practice, again, this can all be handled very, very easily by the local administrators in real time when we wish to do that. So without more ado, let's click on the button and let's log in. I'm very aware of the fact that it can become very, very boring just watching somebody trawling through a website, so I'll try not to take too long. If there are very, very specific questions, please do ask them so that we do know what is there, and Kat, I know, will interrupt and let me know if there is something particularly important. What I'm going to do is I'm going to log in first of all as an educational supervisor. What I will say is the login is quite unusual. You can log in with your username. Normally this will be your GDC number, but for the test we've got a name there and I'm going to put a password in. But you also have the ability to register team member accounts. When we do the patient satisfaction questionnaire, a member of the team, a receptionist or nurse, or several members will need to have their own account so they can then present the questionnaire to the patients on a tablet or a computer or similar. So I'll come back to that later on. But let's log in, let's put in the password, and we're going to log in as an educational supervisor. Now, this is a test educational supervisor. Our name is Elise Kirk, and we have a picture there. It's going to be slightly slow loading because I know AXA are working hard. Now, Elise Kirk is a very, very busy educational supervisor, has a lot of trainees in her practice. It's because she's testing a lot. What we can see first of all is we have the ability here to look at things. There's the edit details, messages, log out, etc. We can see ongoing programs, and we can see buddy assessments here. So if we're invited to a buddy assessment, we can see that there. But let's go down, and I'm going to look at this young lady, Susan White. Now, Susan is just starting out in her dental career, and she registered for Dental Foundation training yesterday evening. And she's started a 2-year foundation training course a week or so ago. But anyway, let's look at her foundation training portfolio. And this is what you're going to see when you log in to your trainees portfolio for the first time. If your trainee has put a photograph there, you'll see their photograph. The photographs really work on this, and for the training program directors, it'll be a great help having photographs so they can see who is there. There's some information about the trainee there. And we can click on here, and I can see some more information. You can see who the educational supervisor is, and who the training program directors are. And we can click on those, and we get some information about them and pictures. Now, as I said, the learning schedule is quite a key part of the Dental Foundation training portfolio, and it appears here. We can click and see what is to be done each month. This program starts in August, yours will start in September. The flexibility of this is that we can start anybody at any time in the year. But in August, this tells us exactly everything that we need to do. Now, when the month moves to September, the schedule will decrease in size, in width, and we'll get another box appearing here which says overdue items. And if we haven't completed all the August work by then, it will appear in the overdue items box. But we have here a lot of the induction items set out in our learning schedule for August. We go down through the page, we can see the dashboard page, we can see the feedback section here, portfolio documentation here with all the usual things, ADEPTs, case-based discussions. We've got reports here, And we've put the induction section there so that once we've got through induction, it's hidden away. Logs are just here, which we can access. And then we have early stage review, IRCP, FRCP, and down in the corner here, a checklist for final review of competence progression. Now, the learning agreement is called learning agreement at the moment. Hopefully by September the 1st, it will be changed to contract and learning agreements. This is where your trainee is going to upload their e-contract document. And I'll just upload it there, and people will be able to access that e-document. Foundation dentist then adds their details. Now you'll notice here these little indicators. They tell us what's going on. These two have been started. Somebody's actually clicked on them. A little clock has turned up to say it's being started. When it's completed, a little green arrow should turn up. The indicators don't work quite in real time. They are updated every 5 minutes. The way Axia have built everything, all of the data turns up in a software data warehouse, which is updated every 5 minutes. That way they can handle vast amounts of data very rapidly, but it is updated only every 5 minutes. So if you've completed something, it'll be 5 minutes before the indicator will change there. Foundation dentist details. This is something which the foundation dentist has to complete, and they do need to add all this information. Hopefully they'll have a GDC number by the time they start. If they don't, then it has to be added, but it is quite important they do have a GDC number. Values and expectations. This is the old values and expectations as it appears in the current e-portfolio. The trainee starts this, and it says quite clearly, review and discuss carefully with your supervisor the obligations and requirements and your signed and uploaded educational agreements. And that gives you a chance to sit down with your trainee and review what you've both agreed to, and then the trainee writes their obligations, and then you have the ability to add your observations and your expectations. We'll see that when we log in as a trainee. And then we have all the other things: induction to practice, induction to DOPS, and non-working days logs, clinical experience logs, all the usual things. Most of these look very similar to the old ones in the old e-portfolio. The ADEPTs, they're all here, haven't changed at all. We add a new one, and there we are. It appears here. We can complete everything, put it in the counter, all the different things, we tick the boxes. Insight into own performance we can add, areas of good performance, areas for development, minutes spent observing, exactly the form, and then the clinical competencies met by this ADEPT. And that's exactly as it's been before. Now, the other thing which has been added, and I'll go into this in full detail later on, is an extra box of clinical categories that this covers. And I'll go into this in detail later, but you'll find this turning up on a lot of the assessment and reflection tools. And this is something which has been added so that we can look and see where the learning for the foundation dentist has come from. Now, the whole time as we're going through the e-portfolio, we've got a breadcrumb trail, and we can go back to the ADEPTs, we can go back to the dashboard, we can even click on the button at the top to go back to the dashboard. So our ability to navigate through the whole of the e-portfolio is vastly enhanced. Now, I'll just show you very rapidly the training program director's view, because that is different when they log in. And educational supervisors, although you might not see this, I think it's helpful for you to know what your training program director can see. Now, this training program director is very thorough. He does GPT, dental core training, dental foundation training, but you can see here, these are the people in the scheme, and they have a mini mini breakdown of everything that's going on. We can see here how Susan hasn't achieved anything, and yet Zavala here, she's got a lot of green buttons here. She's actually commenced the patient satisfaction questionnaire, and it's been published. And we can see here what's going on, how far we've got the reflections, tutorials, study day reflections, etc. And it's a form of heat map as well, ADEPTs and case-based discussions. So the training program directors will be able to see everybody. You see here how useful the pictures are. And again, we can click on pictures and see exactly what's going on for that particular person. I'm going to log in now as the trainee. So you can see the trainees viewpoint as well. This is test trainee 05. And because Susan is doing dental foundation training and dental core training at the same time, she has the choice of programs, normally be a 2-year scheme and a dental core training if you're doing the GPT. But we'll log into this, and again, the dashboard is very similar to your dashboard, but the view for the individual things is different. So the values and expectations, add new, and this young lady can start writing her expectations, send it forward to you, and you can then write your comments in there as well. So what I'm going to do now is log out from the e-portfolio, and I'm going back to the presentation, but are there any questions, Kata, at this stage, which I should be dealing with?
Yes, there are, Peter. So yes. The question is, will the usernames for trainees also be their GDC number, or is this just for supervisors?
No, it'll be basically for everybody, it's their GDC number. If you have 2 roles, it'll be your GDC number with a suffix for one of the other roles. There'll be a slight problem right at the start because some of the trainees might be given their email address as their username for the first week or so, but that needs to be changed to their GDC number as soon as we have their GDC number. But the GDC number is paramount, and that will be your username. As I say, if you have 2 roles, then you'll have 2 logins, but the username, if you do become a TPD later on, then as I say, you'll have a T added to your GDC number, and you'll have a new username for that.
Right, that leads us into the next question. Will new foundation dentists be able to use the portfolio if they have not received their GDC number?
Yes, because we're going to give them their email address. I believe there is built into the e-portfolio, that I haven't seen this, a special tool which enables them to change their username to their GDC number. It's been specified, and I know I've spoken to Max at Axia about this, but I haven't seen that. But yes, they will be able to log in, so have no fears about that.
Great. Next question. Is the new portfolio time limited? That is, currently, if you're on the current portfolio for 20 minutes, unless you save your input, it doesn't save.
Right. Sorry, I should have shown you this. I will show you this. This is something which is very good. Let's log in again as a supervisor. There we are. Now, can you see here at the top? Session expires in 35 minutes. It's counting down, and we've got 35 minutes before it times out. Just before it times out, a message will turn up. But the important thing is, each time I move to somewhere else, it goes back to 35 minutes. Now, the other big problem which happens with the old e-portfolio is if you're writing for 20 minutes and you're doing things in the e-portfolio, it can time you out without letting you know that. And then you go to save things and you've lost everything. That's not going to happen with this because, again, it knows that you're working just by the fact that you're moving the mouse, and it won't time you out like that or lose things for you. This is the best compromise. No portfolio manufacturer will have an auto save, because if they put that in, it could save over things which we really wanted to keep. So that's why they don't do an auto save. But we've done everything we can to make sure that this doesn't time you out. Any further questions?
Yes. So if another member of staff does a tutorial or adept, can one give them access?
Not for a tutorial. For an adept, yes. And I'll show you some of the things. A tutorial would be more difficult to give access to because we haven't built that in. But certainly for a lot of assessments, we have made it such that the other members of staff can be invited. And in fact, we expect this to happen with some of the simulation reports.
Great. Next question. Is there capacity to add additional DOPs?
Yes, I'll come to that when I go through the DOPs. Absolutely, as many DOPs as you wish. I'll come to that later on.
Next question. Will we be adding new things caused by COVID-19 like triage or redeployment, etc.? Yes,
they're already added. Again, shall I? I'll go through the demonstration. Let's just do that. Let's log out of here, and let's just do one or two of these things. In fact, I won't go through the presentation completely because I can go through this bit by bit, I think. So let's have a little look at the, what was that previous question? That was about the DOPs, wasn't it? Let's have a look at the COVID things. Here we are.
Capacity to add additional DOPs.
Yes. Okay. Let me explain to you some of the things which we've added because of COVID. We've added some new reports. And these are reports then because they're not assessments. We're not allowed to put new assessments in because the curriculum hasn't been changed. So these are called reports. And we've got a simulation report and a placement report because some of our trainees are going to be placed in other situations, perhaps doing flu vaccinations or perhaps working in a pharmacy or whatever. We're going to have a lot of simulation, either in clinical skills rooms or perhaps working on extracted teeth or on phantom heads. We've also got a clinical supervisors report, and this is so that a colleague working in the practice alongside your trainee can make a general report on their clinical abilities. And we've got a non-practice multi-source feedback, so if the trainee is spending quite a bit of time at another placement, they can obtain a multi-source feedback from that placement. The simulation learning exercise report is interesting in that the trainee starts it. They then send an invitation to the assessor or the reporter. There'll be a guest, educational supervisor or training program director, and then the reporter completes the feedback and returns the form to the trainee. So here we are. The trainee has to complete the date, describe the nature of the simulation, and the beauty of this, it can cover anything at all. It can be range from simulation of endo with plastic blocks. It could be simulation of giving flu vaccinations. It could be any form of simulation. It could be simulated working with a patient. It could be anything. Then the specific procedures simulated. So some idea of the situation and then what was simulated. They then send this to the reporter, and the reporter then logs in. If they're a guest, somebody new, they can form their own guest account. But if it's an existing educational supervisor or training program director, again, they'll be found by their GDC number. And then the reporter has to list the parameters considered in reporting. Now, this is an important thing. When you're looking at something, you're not necessarily going to be looking at everything. You might, if it's endo, you might be looking specifically at the access cavity, you might be looking at the access, or you might be looking at the obturation. You can write there the parameters which have been reported upon, and then you give your opinion, and your opinion is in 4 grades, going from excellent to needing help, needing large help, to huge problems. And then general feedback on the performance of the situation simulation. And then this return to the trainee. This has a clinical, one of the new clinical area tick boxes to be completed, and I'll come to that in a moment. Here are the clinical categories checklist. And this is something which is new, again, relating to COVID, because this ability to find out where people are doing things. If they're not gaining access to patients very much, we need to be sure that they are seeing lots of patients, lots of treatment in a different way. So each time there's an assessment done, you have to mark which of the clinical areas this covers. Is it radiography? Is it indirect restorations? Is it dental emergencies? And then this will be built up and reported on in the form of a heat map. And this is a heat map right at the start of the year. The rows are pink to start with, and gradually, as more and more things are done, it'll turn blue, darker blue as more things are done. And I'll show you in the e-portfolio later on how you can drill down. There are 2 things there. I can actually drill down and see which specific items have given us the simulation learning of diagnosis, treatment of caries. And we can then see if they're getting all of their experience in simulation and none of it in actually doing it with patients, ADEPs, and case-based discussions, then we are possibly having a problem. And also we've put them in there in significant events and complaints. So if their complaints keep popping up with problems with endodontics, then we know we have big problems there. With DOPS, so a question about the DOPS. The DOPS have been changed in their scale for grading. We now have 3 grades: acceptable, supervision required, and serious concerns. Areas of good performance and areas for development. We can repeat the DOPS as often as we like. Now, there are 2 specific DOPS at induction for the ESR. There's the new patient examination and there's the simple restoration. DOPS are really formative assessment. So if you've got problems or supervision required, do another DOPS. Do 2 or 3 if needs be until you get it to an acceptable level. And we've added generic DOPS to use throughout the year. We're very aware of the fact that the trainees might not have done some procedures for a long time, and therefore before they do some endodontics, you might just want to watch them cut an access cavity as a specific item and have some formative assessment on that. So, other COVID-19 items which we've added additional clinical experience items to the log. Remote consultation and or triage, relevant 3A's treatment, and endodontic access. So they've been added to the clinical experience log. And in the induction checklist, we've added 2 items: cross-infection control and safety within the COVID workplace, and PPE training and providing safe social distancing. So those are items which have got to be carried out and checked in the induction. Okay, Kata, were there any more questions? Have I covered those questions fully?
We've had a few more since you've been talking that I think are quite relevant now. So one question is about the TPD heat map. How often does the data get updated?
Heat maps, again, the heat maps update. Everything updates every 5 minutes because the system goes through and updates things. It will trawl through 1,000 trainees to update the information. So the heat maps will update fairly rapidly. Yes, every 5 minutes.
Great. In the old portfolio, if we completed a section then needed to amend it, we would have to call the company to get it unlocked, the company who supports the old portfolio. Will it be the same in the new portfolio?
Oh, we have discussed this very carefully. We have got rid of most of the locks on things. Axia have never heard of people having to have forms unlocked. They've done a lot of portfolios, and this is something which was, I don't know, quite specific with the HCL one. It might be possible to do that. Certainly there is a helpline where we can do things. But the biggest problem where people had lockouts was with the clinical experience log and the clinical activity log and getting timed out. We've got rid of timeouts on absolutely everything. So we don't think the lock and things needing to be unlocked will be hugely important. We will have to go and see how we manage with that, but I'm sure it will be possible if it's really necessary.
Great, thanks. Is it a mobile friendly website?
Yes, it is a mobile phone friendly website. We've been testing this out for several people, and one of the comments I got back was, oh, this is great. It works really well in landscape view, and it is fine. The whole system has been designed to be used on computer, tablet, or mobile phone. Yes.
Great. We've got two more questions just now. If the supervisor supports both the foundation dentist and the foundation therapist, are there separate login details, or is everything all in one place?
No, let's go back to the e-portfolio. Let's just show you what happens with the login. I'll log in as a supervisor, but one of our supervisors. The supervisor has just the one login as supervisor. And because of the flexibility of the system, we can see everything here. See, this supervisor has got somebody doing, no, we don't have a therapist there. Sorry, we don't have a therapist, but it could be a therapist. This one can even do an outcome 6C, 2-year, and a dental core training. So in fact, this supervisor could see a dental core training e-portfolio if they were linked to them for that. So the answer is yes, you'll be able to see everything just from the one, the single login, and it's really, really flexible. And we can change that. If you can't see something, you just let your local administrator know, and they will change it back so that you can see that if anything's been missed out. Any further questions?
So one more for this section. In the DOPS, are categories put in by the ES or the FD?
At the moment in the DOPS, they're put in by the ES just because of the way it's been built, and we've had to add it in. So I think it's put in by the ES at the time they score the DOPS. Yes. Great.
That's it for this section. Next time you break, I'll have a few more for you.
All right. Okay. Let me just show you this. I'll actually show you live rather than going to the PowerPoint presentation. We've put in a notes section, and we think this is a really rather important part because you can add a totally confidential note which nobody else will see, and yet it's recorded with a date. If you've had a particularly difficult conversation with your trainee, you can write contemporaneous notes here as to what has happened. They're not going to become lost. And then perhaps later on, you might need to transcribe part of these as part of a reflection or part of a report that you will write later on. Nobody else will see these. And yet, if necessary, you could refer to those with a screenshot to show when they were written, because they have been date stamped. So we think these notes really could be very, very helpful. You might want to write something that, or next time we meet, I need to talk about this. It's entirely up to you, but nobody else will see that. That is entirely confidential. There is a messaging system. It's not a proper email system, it's a messaging system, and you can have chats with people, You'll be linked to all the people in your scheme, I believe, because we're testing it. We haven't got huge schemes at the moment, but this person is linked to all the trainees there, and they can talk to them individually or jointly, and you can have a chat. So you can have a confidential chat with the TPD about your trainee, and nobody else will look at that or see what's happening there. So I'm going to log out of the ePortfolio. I'm going back to the presentation. Let's go to the yeah, let's go back to the beginning, sorry. With the login section, I showed you that, registering the user. Now, you'll find that when somebody joins, if somebody joins as a guest, they're quite helpful in the way that they tell you what your password needs to be. And again, if you have to change your password, it has to have upper character, a number, etc. So you can add things there, and then it happens. Now, when you first log in, you are going to see this conditions of using the ePortfolio, and you have to tick that. Nothing terribly drastic there, but you do have to tick that. And then when you log in, I'm afraid you're just going to see this, because as I said earlier, the portfolio belongs to your trainee, and until your trainee has actually been attached to you, or you've been linked to the trainee, you will see nothing. If you get linked to 2 trainees, then you'll see 2. Personal details, again, those are things there. You can put your profile picture in, and you can change your password. Everything there is quite straightforward. You can change your email address and your contact numbers. If anything else needs to be changed, you need to go back to your local administrator. They can change as a misspelling in your name or something like that. They can change things like that quite easily. The notes function I've talked about. Now, the workflow buttons, these appear on many forms. We saw those just a little bit beforehand. Send forward buttons, send back buttons, and we've got foundation, dentist, ES, and TPD. And these change colour according to where the work has gone. And they'll appear on many of the forms. If you go to the ADEPS one, the list, you can see where all the work has gone to. This one here, the ES has sent it back to the FD. Here, the TPD has sent it back to the ES. You can view or you can edit. Some will have a view button or an edit button, and you can do what you need to. The reflections, as I mentioned, these have been upped hugely. Again, the trainee completes to start with. There's the workflow buttons. They can save their work or they can send it forward. But the reasons for writing now are identical for all portfolios, and they link in with the reasons of and the other hints which are in the medical foundation portfolio. And here we are. What are the most important things? Did anything go differently? What have you learned about yourself? Next steps, how has this changed? So these prompts hopefully will help the FDs a lot, because I think FDs need huge help with reflection. They're not taught how to do it. Our job is to guide the FD through the events and the consequences. We must help them highlight the successes, and as I say, don't forget about feelings. They're quite important. I don't believe there are bad reflections. There are reflections which need enhancements and expansion, and we can help our FDs with that. Tutorial reflections, again, these are fairly similar, and you've got the clinical categories as well. And help your FD at the end of the tutorial, before they're going to write their reflection, as to what was good about it and how do they feel about it. Again, you can always send the tutorial reflection back. The significant event reflection, this is hugely changed, because on the old ePortfolio, all they could do was upload a report. Here, they've got a full reflection, outcome, account of experience, analysis of the situation, then full reflection on the event. How do you feel? How does the patient feel? These are the things which the FRCP panel want to see if they can considering whether there's been true professional growth and understanding. They want to know, is there empathy as the foundation dentist? Do they understand the aggravation it's caused to the patient? They can also upload a report, and there's anonymity. And again, we've put these prompts at the top to tell you about anonymity and where you can get guidance from the GDC and the GMC. Patient satisfaction questionnaire. I'll run through this again fairly rapidly. It is paper-free this year. You do need team members to help you with this, but it's the foundation dentist who will set this up. And yet it's you, the educational supervisor, who will moderate this. And they can do multiple patient satisfaction questionnaires, not just one. They can do as many as you wish. First of all, practice team member or members have to register as a user. They log on and they make themselves guest team member users. And then the FD links the team members to their own ePortfolio account, and then that team member logs in, and they'll suddenly find that they can select a patient satisfaction questionnaire for the FD. And they'll need a tablet or a computer for this to happen. Patient completes it, saves it, and hands the tablet back to the team member. So let's look at that in detail. So they register as a practice user. We've got Dora Darwin here. And the FD goes into their portfolio and they put in Dora's email address, and then they can link Dora Darwin to their account. So Dora Darwin is now linked to this foundation dentist. There we are. So when Dora logs in, she'll actually see a box like this. There we are. 50 consecutive patients. Well, I'm going to need 20 before it can be done. There are minimum 20 completed are required. So she clicks on that, and the questionnaire appears, and the patient then completes the questionnaire and press the complete button. If the patient can't text or write on a tablet, then perhaps somebody with them will have to do that, or perhaps even a team member might have to help them with it. Or if you really do want to go back to paper, you could print that out on paper and then somebody transcribe it later, because I know one or two people have talked about we must have paper, but the whole point is let's try and get rid of paper. So your practice is going to need a spare tablet to do this, but it doesn't have to be expensive. You can go to Argos and get an Amazon Fire tablet for $49.99. That'll be perfectly adequate. You can wipe it down with alcohol afterwards to prevent any COVID transmission or anything like that. So it really is going to work, and as I say, it makes it much easier. And you have several team members who can log in and they can all bring this up. If there's more than one trainee in the practice, again, they'll see the different ones and there'll be a picture there so the patient knows which dentist is being talked about. When 20 have been completed, you, the ES, can moderate and publish the report. We see here, here's the heat map, which is turning up. And see here that this, who's this one for? I think this is for, yes, Elaine Zavala. She does quite well with making the patients feel at ease, but as soon as we get on to costs of treatment, she doesn't do so well. And we can see here all the comments from the patients, and we can choose not to publish one. If one is really toxic, we can choose not to publish it. There are several shown, and then you can save the comments to publish, or we can go to the publish report there. Okay, so that's the patient satisfaction questionnaire. And if a second one is required, if IRCP says you must do another one, then you can start them. You can enable that to be done there. A start repeat for patient satisfaction questionnaire. So everything's there like that. Multi-source feedback. I will talk about that at this stage because this is the other thing which is vastly changed. We think will work well. It is paper-free again, set up by the FD. Email invitations sent by the FD. They can resend them, and this has been always the big problem in the past. They resend them, moderated by the training program director. and multiple multi-source feedbacks are possible. So foundation dentist enters the email addresses of the people they wish to send them to. Then when sufficient invitations are in, there's got to be at least 8 put in, then a button appears which says send the invitations. There we are, they've sent them now. And button changes to send email to all uninvited colleagues. If you add some more, you can do that. I can resend the email. It tells me who's been invited and who's started. So this is going to remain here, and we can go back and chase people up if they haven't completed it. Now the training program director again sees the heat map and again look at the way in which the heat map really presents the information in a fantastic way. Sorry. And again, the training program director can choose whether to publish comments or not. And they can publish or unpublish the report. They can start a second multi-source feedback for the DFT if needs be. And again, you can see the summary report, or you can see the colleagues who've been sending things out. So again, there's huge flexibility there. Clinical experience log and report, again, that's much the same as before, but it's dressed up differently. The report is actually visible here by clicking on the different tabs, so you can add all the different months.
Peter?
Yes.
I recommend we have a break just before you go further.
All right. Okay, I'll stop here then. Yes, I'll stop here if we've got some questions. Yes, I'll go back.
Questions about both the PSQ and the
MSF. All right. Okay. Yes, I thought we might have some. Right. Okay.
Okay. So just a couple of questions about the features added because of COVID before we go into those. So we've got 3 questions about the endodontic access. So some people asking, what do you mean by it being a COVID-19 item? And does it need to be completed during induction? Can it be relevant elsewhere as well? It's
relevant at any time. We've put this in because we know that sometimes patients are coming in and the only thing that can be done for the patient, because it's doing any emergency treatment or minimal treatment, is the trainee might just gain access, drain a cavity, drain a tooth, and then leave it. Won't complete the rest of the endodontics. That might be done by somebody else, but that certainly is part of the treatment, part of the limited treatment which might be available. So that's what we mean by endodontic access. And this is done at any time in the year. We are trying to cater for any form of lockdown of dentistry again, or whatever.
Great. And then the follow-up question, would this be before or after the DOPS direct restoration?
Sorry, could you repeat that? Okay, sorry.
So the full question was, does endodontic access need to be completed during induction? If so...
No, endodontic access can be done at any time. It is literally just an item on the clinical experience checklist.
Okay, so the answer is it can be done after the DOPS direct.
Yes, they don't have to do one. It's just in the clinical experience checklist. Yes.
Great. Okay, now moving on to MSF, how many people are required?
8.
Okay, simple.
Yes.
Are ESs able to start a reflective log themselves? Previously, only the FD could start a reflective log.
No, an ES cannot start a reflective log because it is the foundation dentist's e-portfolio and they have to start the reflective log.
Okay. The old EPDP during induction had certain evidence that only the FD could upload. Is the new system more flexible?
I'm not sure what they mean by certain evidence. That the only person who can carry out uploads is the trainee. There is an upload section. It is the trainee's e-portfolio. It's not the educational supervisor's portfolio. So it is the FD. It is the trainee only who can upload items to the portfolio.
Okay. And then we've had a few questions about the confidential notes bit.
Yes.
Kind of assurance that it is confidential, and asking the other way around, when you say no one else will see these, does that include the DFT, joint ESs, TPDs, etc.?
Nobody will see it. It's your login. You're the only person who will see it.
Great. A comment about the trainees GDC number on their personal details page. Someone's commented that the font size looks very small. Is that maybe just because of the way you're sharing your screen, or? It's
probably because of the way I'm sharing my screen, and probably because it's copied from a test one. But the GDC number, I mean, it's as I say, it is just the details. It's just a record there, but it's probably because of the way I'm sharing the screen and the screen clip. Yes.
Okay, great. A couple of questions about the in-portfolio messaging system. Will people be able to get notifications to their personal or like work email address, and will the message itself be in there?
Hopefully, yes. I'm having a discursive conversation with Axia about this. We specified, yes, that you should receive notification about this. Axia in the past have found it very, they've had some systems where they've put this on and they've been asked to take it off. I'm aware that we do need it, and the short answer is yes, it will be there. The long answer is yes, it will be there, but it might take me a week or two to get them to put it back again, so to speak. That's the best I can say, but we do need it, yes. I mean, I'm not going to log on every day just to see whether it's there. It might be that you'll get a reminder at the end of the day you've had some messages during the day.
Great. Now, next question. What do the different colours mean on the workflow?
It just means where it's gone to. Crikey. Let's go back and just see.
I think the question is sort of, is each colour kind of coded to a particular type of activity?
No, it's whether it's green or red or black. We tried not to use red because of green-red problems, but there we are. The yellow means the FD's got to do something, and black means there's nothing there for them to do. So the ES has got to do something there, and the FD hasn't got anything to do yet.
Okay, so it's a red, amber, green rating, but without using the red.
Yes, we're trying not to use the red. Red does turn up if it's been sent back, I think. Mm-hmm. Yeah, well, yes, we have got a red if it's been sent back again, but we are aware of the red-green problems and everything. So, yes.
So it's who's next, with who needs to undertake an activity next. Great. PSQ, can a CliniPad be used? That's used for medical history be linked for PSQ?
I would have thought so. I haven't tried a CliniPad, but anything which connects to the internet and has got a web browser, yes. Yeah, I mean, if you've got an old phone at home, you could use that as well, provided the screen's big enough. It really is anything which will link to the internet, you can use, yes. Right.
So do we have to get patient consent to share patient emails on the portfolio?
Patient emails don't go in there.
Mm-hmm. So the idea is the patient gets the mobile device, they fill it in there, and then it's gone.
Yes, it actually done on practice. In the practice, we don't email it to the patient at all because of the problems of consent and emails and getting lost, etc. The tablet is in the practice, and the team member logs into their account on that tablet, practice tablet, or might even be the FD's tablet if they wish to do that.
And the patient themselves stays anonymous, don't they?
Patient stays totally anonymous.
Okay, so another PSQ question. If a team member has access to the PSQ, will they only have access to this or the whole e-portfolio?
No, literally just that PSQ, and they can't see anything more. All they can do is bring up blank PSQs, and once they've been saved, they can't go back to them. So literally all it does is just like deals a blank card, fill it in, and it's gone.
Great. I think we're moving on to MSF now. Please re-explain the publish feedback aspect. Does that mean if the FD gets a poor rating, they can choose to ignore it and only send the ES TPD positive feedback?
No, because it's the ES who does the TPD who does the rating. If a patient has written something horribly toxic, saying things like "you are a loser" and loads of expletives, then the TPD can choose not to publish that.
Yeah, so I think the important point here is that it's completely under the ES or TPD's control. Yes. The trainee only sees it once the trainer has moderated the information.
Yes, and that is the current system in the current e-portfolio with the multi-source feedback. The training program director has the ability to weed out any toxic or nasty feedback. Yeah.
Great, thank you. That's enough questions for now. Why don't you carry on, Peter?
Yes, right. Okay. All right. Okay. Let's carry on. Where have we got to? There we are. We've gone to the clinical experience log. Again, it's the completed monthly. We've got the months there, and as I say, we've added the additional items. We've added sealant restoration, replacement restoration, and other indirect restoration, because in the past it's just been crowns. We didn't have the things, the onlays and the overlays and the etc. And the other ones which we've added, the COVID ones, are up at the top here. We've added in, we've added them in up here. I don't think they're actually here because they've only added in the very last minute. And the endodontic access is within here in the treatment planning. It's got the triage and it's got the AAAs. That's all been added in this section here, treatment planning and patient management. And then at the top, you can click on the different tabs and you can go to the clinical experience report, and you can see it was a pre-DFT clinical experience as well, if you wish to. So that's where we are with that. Personal development plan. I'll talk very rapidly about this. PDP is purely the FDs. The ES has nothing to do with this except see what's happening. They start a plan and they have to name it. So we'll call this plan DFT, and then they can add particular needs, learning or development needs, etc. It's just like the GDC one. And then when they've filled all that in, it will go into columns like the GDC template. Now, we've done this because it gets the trainees in the habit of creating a professional development plan, personal development plan, which is a requirement of the GDC. This item is what we call global. If they're doing DCT, they'll be able to see this personal plan in their DCT portfolio as well. And likewise, if they've got another plan in their DCT, they'll be able to see that in their DFT. So it is global, it'll be carried forwards, and they'll always be able to see that in the portfolio. The CPD log is pretty much the same as well, just like the GDC one. They put in their GDC CPD year if they wish to, follow the GDC template. And again, it's global and it will go into the categories columns, just like the personal development plan does. Now, the learning needs, and these are different from the personal development plan, because the personal development plan is an overall strategy. I need to get good at doing crowns. Learning needs turn up, or it might even be development requirement, rather than specific learning need. These turn up everywhere. On the main dashboard, we've put it there and you can see those which are outstanding. High needs, medium needs and low needs, importance. And then if you click on that, you can see there whether they're achieved, whether they're signed off. You see, it's been achieved, but you as ES hasn't ticked it to say, yes, I agree. Every form in the e-portfolio has got a button allowing you to add a learning or development need. Now, be careful with this. We've been testing this, and if you get halfway through filling in the form and then say, oh, there's a learning need there, you will lose everything you've put in the form. I don't think there's a way around that at the moment. So fill in the form first, save the form, and then press the add a learning need. Again, put a name in for the learning need. This is what's going to turn up on the report, identified by form ADEPTs, date identified, learning objectives identified, how will it be addressed, when will it be met, what priority is it, low, medium or high. Now, the name, as I say, is important. You don't have to fill this in because it will record automatically where this has come from, and I'll show you later how well designed this is, because you're going to be able to drill back to see where it's come from later on. Learning objectives identified and how they're going to be addressed. So you can write quite important things in there. And it's not feedback, this is learning objectives identified. You've already given the feedback in the DOPS or the ADEPT or the reflection or whatever. So you want to say, you need to learn how to use this, and it'll be addressed by a course or something like that, and date. Now, priority and date are not the same thing. Something can be high priority, needs to be done straight away. It might be low priority, but it could still be done in the next week. I think the priority is the importance. So what I'm going to do is I just want to show you something with the learning needs. Let's just log into the ePortfolio again. Let's see trainee 01. This is Elaine Zavala. She's done most things in this portfolio. So we go to Dental Foundation Training. We can see here her learning and development needs. And okay, she had one here, problems, authority and obedience. Don't believe this, the wording, this is just, and then it's come from a pre-DFT clinical experience review. And I click on that and it'll take me straight back to where it's come from. There we are, and I can actually read that. I'll go back again, sorry. So it's all there. We can go around, so everything is linked in together. Sorry, that one wasn't a very good one. I didn't link back to the right things. Let's try this one, Invisalign problems. It's come from a reflection. There we are. It takes us straight to the reflection. And we might have had 2 or 3 learning or development needs from that. If it was, say the induction, we might have had 3 learning development needs from there. They'll all be listed there, and we can go back to them. So you can see there the cross-linking which has been built into the portfolio is huge. Are there any questions at this stage, Kata?
Yes, there are, Peter.
I thought there might be.
One moment, please. Okay, so can we save the MSF midway?
What do you mean, can you save the MSF? I don't understand the question. The MSF doesn't disappear, yes. I mean, you don't have to do any saving, it just happens. As soon as there are 8 visible, then you can report, you can publish it. And if some more come, you can republish, yes. Yes.
So I think the question might be sort of the people responding to the MSF, they can respond at any point. It doesn't all have to happen at once. No. So if you've got 8 and still another 4 to come, you can publish and you'll see the next 4 arriving and then you can add those in, yes. Right. Considering social distancing and limiting contacts, can the PSQ be undertaken remotely?
Well, it's got to be done within the practice, hasn't it? But they can take the iPad away to the other end of the room, can't they?
So the answer is no, it can't be undertaken remotely because it needs to be done in situ straight after this.
Yes, because we can't email it to somewhere else. Yes.
For the MSF, what if there are less than 8 team members in your practice?
There's always the problem which comes up, and it's always fixed to date. For people like technicians, and also the trainee can go to peer members of their group if they really need to. The number of practices where there will be less than 8. Don't forget there's the cleaner as well. a technician, there might be a prosthetics technician, and there might be a crown and bridge technician. They can give feedback. There's the cleaner, that's 3 people. Going to be at least 2 nurses in the practice, that's 5 people. Might be a couple of associates, might be only 1 associate. It's got to be at least 1 because there's a nominated individual to help cover. And there's probably a receptionist as well. So you are going to reach 8, aren't you?
And I think the important point here is that this is a national directive, and the ePortfolio functionality has been set up to satisfy the national requirements. Okay, next question. It's more of a sort of suggestion about the workflow. Someone has suggested that having arrows in the workflow would be helpful.
Yep, probably could be helpful. I can't see Axia doing that. We've already gone, but yeah, sorry, I would agree there. And I do want to try and improve things, but
okay,
but
so
that's what the little lines are for. The colours of the lines change as well, so they tell you the direction it's going. Yeah.
And important to know that the system will evolve and improve as you start using it. So do send us feedback, and we will take that on board, and we'll have a continuous improvement cycle.
Yes, Axia understand that they will need to change things. They're expecting feedback and they're expecting changes. That they are not washing their hands of it. We have gone considerably further than the original specification in many areas, and I think we've pushed Axia quite a bit. But I'm very happy to try to make the portfolio better and better and easier for you to use. So yes, your feedback as you use it will be really, really helpful. So I've had a couple of test groups working, and some of the feedback they've come up with has been really, really helpful, even down to spelling mistakes and typos, and we've got to go through and correct a load of those. So yeah, your feedback is welcomed, please.
Great. Question about the PSQ. Which team members can carry out the PSQ?
Anybody.
I think that means which team members can administer the PSQ.
Anybody, each of the receptionists, anybody you like. All they've got to do is log on and hand a tablet or something to a patient. So it could be anybody.
It's a local decision as to who is given access to do that, but anybody can be given that access.
Anybody, literally anybody.
Great. Next question is about the sort of the time element of using the new ePortfolio. So the time element to do all this online EPDP was already huge and is now increased. If one is going to both read everything properly, reflect upon it before adding in comments, reports, as well as decide to include or not feedback comments, how long would you recommend trainers put aside to deal with the EPDP, as well as the
Fine. I hope you're going to find that because it flows a lot better, it'll obviously be much easier to use. The old ePortfolio was very difficult to navigate through. You couldn't go back if you had to keep going back to the dashboard and then drilling down again. I hope you're going to find it a lot more interactive and easy to use. Set simple things, the boxes, as you type things in, the boxes expand. So it's not going to run off the corner of the pages. You haven't got to hunt looking for what words you've written. I think you'll find it so much easier to use, and all of the comments we've had from people who've been testing it are that it is so much more user-friendly that they enjoy using it. So hopefully it won't take you much. Well, hopefully it won't take you longer at all to use. There's more tools there, but it doesn't mean to say they've all got to be used to the same amount. It's to give us flexibility so we have the right tool for the job. So hopefully you won't need much more time, if any. Right, does that answer the question? I hope it does.
Okay, so next question. I'm not sure if this is relevant to functionality or not, so do let me know if it's not, Peter. What is the difference between AAA and triage? Are they not the same? We can defer the question. We will pick up questions that we've not been able to answer within the...
Triage, quite simply, is putting people into one of 3 categories. And it's a military term, and when you first had a battle, you separate out the dead, the walking wounded, and the living. And those are the 3 categories. And so sorting them into 3 categories. So triage is originally just some sort of 3 A's is treatment, it's AA, it's antibiotics, advice, and alcohol. I think no, it's not alcohol. Please, no, that's me being flippant there. But as I say, it is a quite specific form of treatment, and okay, it might be alliterative, it might be copying things, but as I say, we've put them both in. Yes.
Okay, thank you. Are there a minimum number of learning needs required?
That is a local decision, isn't it? It's not set out in the curriculum as a minimum number. It's there as a it's not an assessment. It's something to help you and to show that you're actually learning and that your FD is learning, that you're addressing everything. Now, in our region, the region where I work, I know as part of the FRCP requirements, it was expected that there would be 15 learning needs. That is a local decision which is made by somebody, and I don't think it's really anything to do with the portfolio. That's an educational question, and I think we'd all have our own opinions about the value of using that as a form of assessment. That's a very tactful answer.
Great, thanks, Peter. Is the significant incident log confidential? Would it be accessible to the GDC if there was a complaint?
You must remember that the e-portfolio is what the legal people call a known document. There's no secret about it. It is a known document. And of course, they can subpoena access to the e-portfolio at any time. And it therefore behoves you to make sure that if you've got a trainee who does have a learning need, that you have recorded that learning need, you have addressed that learning need, and you have assessed their ability to overcome that learning need or to move on from that learning need, such that if there are problems later on and there are significant events, then you can show that there's no negligence on your part, or the FD's part, hopefully. So there is no change in the ability of the courts or the GDC to look at the e-portfolio. It is a known document, and you must always remember that, and that's why the confidentiality aspects are very, very important. That's why I put the advice in this year. But it can be your defence if somebody claims, well, your trainee hasn't learned this, and you can say, yes, look, we've done this, we've addressed it, and we've assessed it. Here's the written evidence. Here's the learning needs, the development needs. Here's the learning which they've done. Okay.
Great, thanks, Peter. And then one more question about the MSF.
Yes.
In the past, well, if you've saved it, then you could not re-access it. Is that going to be the case here? Yes,
because if it's been passed on, you can't re-access a questionnaire. So you can resend it and send another one in. Yes.
Great, thanks. That's it for the questions for now.
Thank you. Right. Okay, new reports. Simulation report, we've done these, looked at those. So that's that. And the clinical assessors report. I think really we've covered pretty much everything which there is in the portfolio. I don't think there's anything else which I wish to show. Are there any more general questions at all? What I'll do is I'll bring the e-portfolio up and we can look at that. If we've got the e-portfolio there, I'll log on again as a supervisor. So any questions at all? There we are. There's the supervisor's view coming up.
Okay, another question then. Is there going to be a help button or hyperlink for those times that things don't go to plan? So the company who supports this ePortfolio, Axia, do have a help desk. So the help desk will be accessible at all times.
Yes, support at the bottom, support, and the telephone number you can ring. Hopefully, you won't have something not going to plan. If something does, then again, you can speak to your TPD or your buddy ESs and find out. But Axia will be there. There's a support desk there. You can raise a ticket or you can phone them. It's very difficult because I can imagine things will happen, but until you know exactly what it is that's gone wrong, it's very difficult to write the specific help for that. And we've gone out of our way to try and make the whole ePortfolio so user-friendly and intuitive that you shouldn't need much help. And we're going to be writing some user guides, just setting out the procedures for PSQ and MSF. They're probably the most difficult ones, and also inviting buddy trainers or guest assessors. So we'll put out some written information about that. But once you've done it once, it's really remarkably straightforward. So I hope I've managed to answer that question as best as I can. Is there anything more? Any further questions?
Okay, so the next one, there is a rumour that the new ePortfolio will generate a certificate of satisfactory completion automatically. Can you confirm if this is or is not the case?
The specification for the system is that after FRCP, the system will produce a certificate of satisfactory completion, which will then be downloadable by the foundation dentist. And that will happen. It's not been put in yet. That is scheduled to be worked on by Axia during the first week of September. There's a fair degree of urgency because the outcome 6C ePortfolio will require certificates to be available probably during late September. So we're working on that. The system is also supposed to produce a report giving the names of all the FDs who've been satisfactorily completed, so that hopefully then the local administrator can pass that to NHS England, so the actual need to send a certificate might even disappear. That's what I would like to happen. But yes, the system will generate the certificates, and also the same for PLVE. It'll produce a certificate. We've got an outcome 6C included as an outcome for next year in the FRCP, and if that is the case, then the trainee gets a certificate of having undertaken a period of foundation training, and it has the competencies they've achieved on the back, and the system will be generating that as well. We're asking it to do quite a lot. So yes, that is the answer. It's not a rumour, it will be fact. It ain't there yet, but it will be there, I promise you.
Great, thanks, Peter. We've got a few more questions coming in. So the next one, is there a specific section for molar endodontics to be completed? Is there a specific section on the portfolio where that can be recorded, I think is the question, and will the portfolio have uploaded to it a specific number?
Well, this comes in the clinical experience report and the let's have a little look here at the, where's it gone to? Complex treatment log. Now the complex treatment log will actually automatically populate itself. So there's endodontics multi-rooted, endodontics single-rooted, and this is number one. It's not performed on month one. It will do that there. So if in month 2 they do a multi-rooted endo, it'll say month 2, and then do another one, month 2. So it'll record them because there are minimum requirements, aren't there? And I think there's 4 multi-rooted and whatever. It's in the original curriculum, but these aren't really set as as targets, because the targets change, and they were changed this year for FRCP. So this will automatically complete itself, and that's completed from the clinical experience log where the trainee enters. Susan White's not started, so they are. Oh, because we're not logged in as the trainee, but it will appear from the trainee. So they'll actually be able to do that. Shall I log in as the trainee so you can see that exactly? There we are. So log in as the trainee, Dental Foundation Training, clinical experience log. Start the log for August. Yes, I know it says August twice. We've got a bug there. We're not quite sure why it does that. Axia are aware of that. There we are. They can put everything in there, DNA numbers. And here we are. We can see remote consultation and/or triage, relevant AAA treatment, endodontic access for drainage, etc. There we are. And then we come down to the endodontic treatment. Where's that hiding now? I've lost it now, but it is there, isn't it? I can't see it. It is there. Yes, root canal treatment, incisor canine, premolar and molar. So they can enter the numbers there quite easily. So, yeah, that's where we are. Okay, Kata, question answered.
Okay, so next question, are confidential notes time-stamped or just date-stamped? So is there a log of
just date-stamped, just date-stamped.
Okay, thank you. Is the Therapist Foundation portfolio constructed in the same way?
Yes, it is. Would you like to see one? If we've got a therapist here, let's just have a little look at one. It's almost identical. I think we've got one hiding here. Got so many test accounts all over the place. I'm not sure where they are. Dental Therapist Foundation training. There we are. They have a time schedule as well, overdue items, but it's set out in exactly the same way, but certain things are missing. They've got generic DOPs as well, and their DOPs are different: simple restoration, simple scaling. These are their induction DOPs. There we are. But otherwise, it's all pretty much the same, so it's easy to work through. Oh, this is something I forgot to tell you. There's an invitations log. If you've been invited, if you're the trainee and you've invited lots of people to do assessments, you can see who's assessed them or who's outstanding. So that's something which is quite useful. Okay, does that answer the question? I hope it does.
Great, thank you. So, how long after the end of training can the information on the portfolio be accessed?
Right. At the end of the programme, the administrator locally will complete the programme, and then the e-portfolio won't be able to be edited or updated. There is going to be a download facility which will be put in as soon as we've got everything complete, and everything isn't complete yet, so you'll be able to download the whole of the information in the form of a PDF. We've got some problems because GDPR regulations say that data can't be held for longer than is necessary, and I think the decision we've come to that the portfolio will be available for 6 years after the date when it was last accessed. So all you've got to do is log in every 5 years and your portfolio is going to last forever, provided the contract with HEE is still remaining. So I think that, am I correct on that, Kata?
Yes, that's correct.
Yeah. So it's going to be there for a long time. Yes. Any more questions?
Yes. So the next question is about the simulated learning functionality, which has been added due to COVID. So there are just a couple of questions to clarify what you mean. Are you talking about phantom heads and things like that? So just a bit of clarification about what that form will be relevant to.
Literally anything and everything. We don't know. We really do not know. It's been made as generic as possible. Phantom head will do. If you want to do some work in the practice on extracted teeth, that would be simulation, and you could do reports on that. If you want to do some work in the practice on endo view blocks, that would be simulation. If you want to do a simulation of a patient meet and greet, or working with PPR, that could be a simulation, couldn't it? You could, yeah. Your imagination is only the limit to what goes in a simulation. What we're trying to do in the e-portfolio is to build up evidence to help our review panels see that our trainees have got a wide experience in education and ability. So if it's useful evidence, then we can put it in. Does that help? I hope it helps, but I really don't think the simulation report is limiting in any way.
Great, thank you. The next question, is there good backup and site security given recent high-profile hacks?
Is there backup? Yes. Yes, there are backups. Axia has had to pass very strict data management requirements set by HEE, and I think they are as secure as anybody can be secure. Yes.
Great.
Provided somebody keeps paying the money, but I'm not supposed to say that, am I?
The system is secure, and we have a long-standing contract set up with the supplier.
Yeah. I don't think that is a concern.
Next question: how has the buddy assessor area been enhanced? Are buddies invited by ES as previously?
Buddies can be invited by the foundation dentist or by the ES, and if it's an ADEPT or a case-based discussion, it has to be another educational supervisor who is added. But for any of the other ones, the simulation exercises or the clinical supervisor report or the placement report, they can invite any suitable person as a guest to do that. The whole procedure is a lot cleaner and a lot easier, and the guest will get an email telling them they've been invited. And as I say, let's just go and have a little look here, because we might be able to see a bit better what's going on if we look at Elaine's invitations log. You'll see here she's sent invitations to all these people, simulation learning exercises, ADEPTs. There we are, this one hasn't replied, so she can resend the invitation, etc. So we can see everything that is there, and they've sent it to somebody else. So that select clinical supervisor to invite. So she hasn't found a clinical supervisor, so we can resend them. So it is remarkably user-friendly. Hopefully that answers the question there.
Great, thank you. Now we have a couple of questions about FRCP. This first question is related to something you'll have said, Peter. I'm not entirely sure which bit. But the question is, so does that mean there is no panel for assessing FRCP? I think the answer will be no.
There is a panel, there absolutely is a panel. The checklist here is literally just a checklist of what's going on.
Mm-hmm.
And you'll find that all of the FRCP panel members, all of the TPDs, we actually complete our own spreadsheets with much of this information, and everything's carried through there. but there's certainly a panel which is going to meet. There's an FRCP stage 1. You've got to do an ES report, TPD report, a stage 1 panel, and the stage 1 panel can give an outcome 6, or an outcome 7, or an outcome 5, or an outcome 6C. If you give an outcome 7, it has to go to a stage 2 panel report, and they can give a 3, which means an extension, or they give a 4, which means that you leave the program, or they can give a 6C or a 6R or a 6. So it's exactly the same as before, we're just given more information for the panel. The panel members, again, can be brought in from anywhere, and we've given huge flexibility for the local administrators to bring the panel members in, and external people can be catered for very, very rapidly. I hope that answers the question. So the FRCP and the IRCP are identical, but it's all better managed, we hope.
Great. Next FRCP question. At FRCP stage, the question of whether the trainee is safe to practice independently currently only has the option for one answer. If the two trainers do not agree, then one will be overruled. Is it possible to allow the question to be answered independently by both trainers? So I think the question here is more, how is the system currently set up? Any changes to that we'll need to discuss in a different forum. But Peter, if you could just show us how it's currently set up.
Yes. Now, I think we've got it so that each trainee, each educational supervisor can log in and produce a report. And you can produce more than one report, because if there is a stage 2 panel, you might need to produce a second report. So I think that each ES will be able to log in and produce a report, but I haven't tested that. That's possibly something I need to go back and test. So I think the answer is going to be yes, you'll each be able to do one. But that's something I need to look at, and I think it should be such that you can both do one. Yes. You will notice that this year you had to complete the supplementary report. That's been built in, and there's no button to press. It's now there for everybody to complete. There we are. And as they please summarise your reasons if there's no reason above. So you actually have to put things there. So yes, does that help? I hope so.
Thank you. Okay. Next question. Can the ES or the DFT upload a radiograph, photograph to support the reflection or DOPS?
What we've got is one upload section, two upload sections. One is for projects, presentations. The other one is an upload section. We've modified that slightly because in the past everything has got muddled up. We've now got CPD certificates can be uploaded, BSA compass schedules, and then other. So that's where you would put the radiograph, which went with the DOPS. We don't have anything attached to the DOPS at the moment or to the ADEPT. It might be nice to do, but then we might possibly be using other review materials like MedShare or something like that, which is being used in some areas where the photographs can be added. The other, the other area where there are uploads are the, as I say, the projects and presentations area. Sorry, I've totally mucked this up. And if we go back there, and the projects, presentations, audits and surveys. And again, these are quite specific, but that's not where you would put the single radiograph. It's going to have to go in the ordinary upload section. So it's not really what you'd like, but it's slightly better than it was before. That's the best I can do at the moment.
Okay, next question. I can answer this. For an outcome 6C foundation dentist, will they be created with a new profile on this system? Yes, they will have a new profile on this system to finish off whatever they need to finish off.
Yes, it's a totally new e-portfolio will be given, and also the information which is on the spreadsheet produced by the FRCP panel will be carried forward into their outcome 6 portfolio, which tells them specifically what they got to do. The outcome 6 portfolio, I think we've possibly got one here somewhere, perhaps not. It's a very, very cut down version. It has minimal amounts in, but yes, they'll have their own outcome 6 e-portfolio just to complete those last few things. Okay.
Next question. Have the gradings been changed for ADEPTs and CBDs, or are the forms the same as in the old system?
No, they're the same as in the old system. I think it takes an act of parliament and goodness knows what else to change those. That is being looked at quite specifically. And I think there are moves afoot to be updating the curriculum and the assessment. And that's one reason why I put the clinical categories in. We're moving halfway there without having to change the curriculum. I better not say anything more at the moment, but no, unfortunately, there is no change there. It is as it is.
Okay, now next question leads us into something a bit wider that I think will be helpful for you to share, Peter. So will there be input into the new portfolio from the student passport, which is being developed, giving access to FD's clinical experience from university? I think the answer to that is no, certainly not for this first year. But we have set up and are continuing to set up links with some other systems that will feed into the portfolio. So Peter, can you tell us about the systems that we have set up?
Yes, I will do. Now, the passport, that was one of the things which we wanted to do. We specified, it's still in the specification, that the trainee, that we should be able to link it to a lot of items, including the BSA for the UDAs to be included, and also the e-learning. The passport we had a slight problem with because there is no one standard for passport, and it'd be great if we could do that. And I hear what you say. I would love to be able to do that, so we could just import the passport information and it'd be there. It's not there yet, but we'll work on it. But let's have a little look at this. Let's just log in as the trainee again. Let's just log in as trainee 01 because it's the quickest one. We've got a rather enigmatic page here, and I say enigmatic. It says here at the top, script. What's going to happen, and everything is sitting there just waiting to be activated, is that when the trainees undertake a script modules, the script e-learning program, the certificate comes straight into the e-portfolio. An identical system is being set up with e-learning for health. What we've got to remember is that all of these organisations are under immense pressure because of the COVID situation to get things done. It's not the work of an afternoon just to set this up, because there's a lot of security checks need to be made. We want to make it such that our trainee goes straight from here to e-learning for health, do a module, and the result come back again. And hopefully that will be working within the next few weeks, fingers crossed. I was hoping we'd have exactly the same as with the BSA, with the UDAs, but that's just not happened this year. That's something for the future. So it's the best answer I can get. Watch this space. I really do want that to happen. Yes.
Right, thank you. So next question, you mentioned that if joint ESs both comment on something, they should put initials to identify which of them has said what. If one ES does a tutorial write-up and submits it on their own, does the portfolio automatically say which ES has submitted it? Do we need to put initials on everything?
Yeah, no, I don't think it does at the moment, and that's what we're just exploring. So put your initials at the bottom of it at the moment. It's something which has already been flagged up with Axia. We're just trying to work out how we can do that. So I would say at the moment, please put your initials at the bottom.
Okay, great. So those are all the functionality type questions, and I've left one question to the end, which is about the logistics of go live. So the question is, when does the new portfolio go live, and is there a test login for people to use?
Okay, right. The portfolio goes live as soon as your administrator can import the spreadsheets with the ES names and the trainee names. At the moment, there are no test logins, and it occurred to me that that might be very, very useful, and I will try and do that. The thing is about test logins is they have to be set up as user accounts in exactly the same way. And it might mean that what we'll have to do is have one test account per scheme or per region. I'm not quite sure how we're going to do that. We will try and do that. My experience is that you, in fact, probably won't need a test account. Those who've been using it have said, no, it's just so easy, they can manage. But you'll be getting your logins literally within the next few days, because today Axia are uploading all of the information about the administrators and the TPDs. On Friday morning, I'm having a webinar with all of the nation's administrators, and we're going through exactly what to do. They've been busy building the spreadsheets. Everything is going to be uploaded from a spreadsheet. They're building the spreadsheets with all the educational supervisors' names on and all the trainee names. Then they just upload the spreadsheets, and then every 5 minutes the software goes through, processes it, and sends an email out to you. So it could be any time within the next few days that you'll be getting your email and you'll be live. As soon as your trainee has got their portfolio, you'll be able to access it there. I'll see whether I can get some test accounts sent out to everybody, and that's something I might have to work on at the weekend.
Great, so thanks for that, Peter. We've had a few questions throughout the webinar about the sharing of the webinar itself. So the webinar is being recorded, and the recording will be circulated via the usual networks. So the way that you'll have heard about this webinar in the first place, we'll make sure that it's circulated that way, and it will be openly accessible to anyone on the webinar, anyone who wasn't on the webinar as well. So wait to hear from your local network leads. The information will be circulated far and wide. And we will also make the slides that Peter delivered available for you to look back on, just the slides themselves as well. So we've had quite a few questions about those. We'll make sure that that's all available. So I've closed the Q&A session now so that we can wrap up. Peter, is there anything more you wanted to say before we finish up?
What I'd say is, I think you're going to find this e-portfolio much easier to use. I think your trainees will find it totally intuitive. I hope that you'll get a great deal of pleasure from using it, so that you can spend more time helping your trainees. If you have got problems, or if you have got feedback, please let us know. All right, we're not intentionally trying to give you problems, we're trying to make it easier for you. So if you've got some bright ideas, let us know about them, please. We'll see what we can do to incorporate them. I can't promise everything, but just go and have fun, enjoy it, and I hope you have a really good training year. We've had enough problems with this COVID thing, so let's hope that we do have a good training year. I say good luck to you all.
Great, thank you, Peter. And there have been a number of questions about local arrangements, about requirements, about possible challenges, issues that you think you might come across. I really encourage you to explore these within your local network, speak to your leads. There are a number of national forums that deal with these, so please do speak to your leads to escalate it up if you think it needs escalating. As Peter said, we are listening, we are taking feedback, and we know that it will be a learning process once the portfolio goes live. And the way the system has been developed has been in collaboration with representatives from the 3 nations and with representatives from a number of different user groups. So we've made the best decisions that we can based on those. But please do keep speaking to your local networks and resolving and working through options to resolve any challenges that you come across. So thank you very much for attending the webinar. Like I said, the recordings will be circulated, and we hope we wish you all the best for the new training year and for using the new system. Thank you very much.
Thank you. Bye-bye, everybody.